Good morning, everyone. I'm Stanley, the founder and chairperson of DXY. So today we are at CDA 2025 in Chongqing, and we have three distinguished guests here. They are Christy Langen, so you are the CEO of International Psoriasis Council, and also Professor April Armstrong, and you are IPC counselor and also the chief of the Division of Dermatology at UCLA Health, and you are from the West Coast.
Yes, thanks for having me here.
And Professor Xu Yuling, IPC counselor, vice president of Shanghai Dermatology Hospital and Tongji University. So today we are going to talk a little bit about the disease control, including patient education, and also the most important part will be the physician education. Because IPC, you have the vision of a world in which every individual with psoriasis receives optimal care. So Christy, from your perspective, can you share with us what is the biggest challenge in your job and how do you conquer this challenge to achieve your goal?
I think one of the biggest challenges around the world is really the access to the medicines. That's one, no matter where you are, it's a challenge to get to the right medicine at the right time. And so the things that we work on, because in support of that is evidence-based guidelines and recommendations, which are extremely important, not only for the clinician, but also for the government and whoever's paying for treatments to know that these are evidence treatments and they will work with the patients. And I think those are the two main things that we all have to work together to overcome to get the best treatment for patients.
So in terms of the access to the patient, I believe economy would be a very big issue. I have to say the drugs sometimes they're just very expensive.
Yeah.
So from your perspective, how can we leverage the resource and gather the power from the pharmaceutical companies to achieve this vision?
That's a big question. I think from our perspective, we've really worked close with our patient advocates, and we believe that the change will come when the patient and physicians work together to move forward access to those treatments. I think that the pharmaceutical companies are businesses and for profit, and they still need to make money to keep investing, and I think we continue to push them to lower prices when they can and make things more easier to access.
Yeah. Actually, in China, the government is also trying to negotiate with the pharmaceutical industry and trying to lower the price, which could include their products into the basic medical insurance. So I think the government and also the medical associations, patient advocacy groups. So we are working together with the industry and trying to provide more accessible solutions to these patients. Yeah. So Professor Armstrong, I know you are a doctor in the hospital, and from your perspective of the global practice, what in your mind, what is the most important misconception that needs to be corrected in patients' mindset?
I think that when I think about my patients, one of the things I spent a lot of time doing is actually explaining side effects. When patients hear about side effects, they think it's going to happen to them, and it's 100%. Many of them do. So I spent a lot of time telling them that the rate at which occurs, how commonly it occurs, and also the likelihood that they may experience that. So I think it's really important for our patients to understand the benefit of a medication, but also understand the side effect profile of a medication appropriately. And also understand the cost of not treating a disease. That's oftentimes not discussed. So I would say that's probably one of the key misconceptions when I speak with my patients, and I can see why they would think that. So having this new understanding of the exact rates and also the likelihood for that particular individual in terms of experiencing side effects is very important.
And that is one aspect. You mentioned that the patient may have the misunderstanding in terms of the side effects. But another side is, well, in China, actually, a lot of patients, they came to the doctor's office and they will tell the doctor, I heard there are some magic therapy or magic drugs which can cure my disease. I was from Harbin. When I was very young, when I was a kid, there were a lot of advertisement about psoriasis, which some people claim they can cure this 100% through some very magic solutions. So how can we conquer, or how can we defeat these misinformation or disinformation from your perspective?
I think having the regulatory body that adequately evaluates the evidence is very important. I know in the United States we have the FDA that help evaluate the evidence. So every medication that's approved must have to prove to the public through its clinical trial results that the benefit outweighs the risks. And I know in China you also have a similar regulatory body.
CDA.
That exactly, yes, CD that does
yeah.
that. So I think that's extremely helpful, because claims can be made by anyone, and sometimes we are trusting the source. So the source where the information comes from is important, and also whether a medication or whichever therapy, medicine or a physical phototherapy or whatever the modality is, making sure that's evaluated properly by an impartial regulatory body is very important.
Do you believe TikTok could be a good channel for doctor to engage with the patient?
You know, yes. I have only my mother or like one other person following me on my TikTok. I use it once every few months. Maybe I should use it more often. I do think that's how patients are getting their information, and they are getting information from people who may not have a medical background. But those people can be extremely convincing, right? And so they can relate to people very well, and so the patients hear that and they really believe that. I think it's very important for the medical profession to be represented in those channels who have the knowledge, the credibility, and just the wealth of information that we have about not only how one medicine works, but all of the medicine works.
Good, very good to hear. And the Professor Shi, do you have your own TikTok in China, like Douyin or Red Note?
I have, but because I don't have to, to use it, but still I have it. I think even though in my hospital we just encourage the physician to to do medical education in TikTok, because it's a large, huge population to use it. So we just want to convey very positive the signal to the patients. What's going on? What's the right the advice. So also my government still very control the TikTok. So it's very strict policy to address some the video or some knowledge. So the government do a lot of things.
And you are from Shanghai, and you are kind of like a very reputable professor, which has international experiences and also domestic experiences. So from your perspective, your practice in China, when you introduce these international standards or advanced knowledge into the Chinese context, what are the most common feedback from Chinese doctors, Chinese dermatologists?
I think in China, especially younger physician, younger dermatologists. Yesterday we have a very successful IPC match class. Christy Lagan invited almost 60 delegates to attend our IPC match class, and most of us from China, from different cities, different hospitals. We can see the young dermatologists have a very good, I think, the advances in our field, and they can a good English, ability. Also, they did a very good clinical research, and also but still there are some physicians from different area. They want more international, maybe the knowledge. And even though we just get a lot of knowledge from the PubMed, from literature, but they want to face to face to, such as the big experts such as April Armstrong, they want to discuss with you. And a lot of knowledge, clinical knowledge, cannot get from the PubMed. We need to talk experience. What's the real world study experience? So I think for the Chinese physician, we need to do more contribution to different committee, and I think attend, participate in some international, the Congress, also give the good oral presentation and convey our Chinese, the successful knowledge and our contribution, to do more contribution to the world.
Okay, I have one more question for you. Like you mentioned that the international guidelines and also the face-to-face communication is very critical to the doctors. But in the real practice, because my background was neurology, I was practice in the hospital. So from my observation, that guidelines or consensus looks like a songbook in the karaoke. So when people always claim that we follow the guidelines, we follow this songbook. But when everyone starts singing, it sounds like totally different. So how do you solve this problem? I mean, from the guideline to the real clinical practice, there's still a lot of gap in between.
I agree with you. It's a very good question. I think, but we want to do our best to do a perfect guideline that every physician can follow it. And I think it's, it's very feasible for us. I think now, previously, we participate, every guideline for psoriasis. And just I have already submitted the PSA guideline to a Chinese medical journal in English and in Chinese. So the dermatologist and the rheumatologist and the ultrasound experts, image experts, and cardiovascular experts, we just work together to do this guideline. I think we just looking forward to publishing soon. So I think now, maybe 10 years ago, we just follow up the USA guideline, European guideline, but now our Chinese physicians have already did a lot of real world study work. So it's different from in different countries. So we have a very solid evidence for you mentioned for our practice. So now we just already put our the experience, our solid evidence already published in JAD, in British Journal, Dermatology, high impact journal. So the all-round experts accepted this concept. So we just encourage every the expert put their experience into our guideline.
Yeah, and I would say what Professor Shi said is very important, because for many diseases, the Chinese population may have different genetic predispositions, so their manifestations can be very different from patients from other countries. So recognizing those genetic differences, as well as some of the health system related differences, is very important in coming together with guidelines that really work for a particular region.
Yes.
And one of the things IPC's been working on and just launched a few weeks ago is what we're calling our rapid communications. And the idea is to look at where are the gaps in the guidelines and how do you take a topic that is very complicated and put it into a more simple clinical use. And we went out to our community and said, what are the biggest gaps? What do you need us to write in like a 500-word statement? So we had 40 submissions, 48, and we went out to all of our counselors plus our industry partners and asked people just to say what is the kind of hot issue. So we're in the process of kind of going through those, seeing what could be addressed in a short communication. And they could be topics that everyone knows that this is how you do it. And it even can be in the guidelines, but it's so complicated, people don't know. So that's one of the things that we are trying to do from a global perspective. We also know there'll be some regional implementation. We did one recently around defining topical failure, and our counselors from the Latin America region, there's some things in there that they don't doesn't necessarily work for them. So we'll be discussing how do we take this short communication and either do a response or some sort of communication that's to their region that works better. But we feel like from a global perspective and a global organization, we want to put out what we think is the gold standard if all things were equal, right? So we're excited, and we hope it will help with the either lack of guidelines or the complicated nature of them.
Story. So, Professor Molita, I know you are from the Department of Geriatric and Environmental Dermatology. So I understand the meaning of geriatric, but it's very interesting to me to see the environmental dermatology. So can you explain to us a little bit about your background and what is environmental dermatology?
Yes, for a long time in history.
Okay.
So my previous professor chairman and major in it's aging. So
Aging,
he think about geriatric is fine, and also I was doing in research and for photobiology, especially and ultraviolet. So that is we together like for photobiology and environmental insight for photoaging. So that is we together geriatric and environmental dermatology. Okay. But we have only one dermatology. We can say not specifically, not a specific name, but then just name. Geriatric environmental dermatology. But it's our focus on, of course, in the geriatric. It's aging, skin aging, and also photo aging, but also me and for photobiology and food therapy.
Well, here is a fact I want to share with all of you, that China is also entering into an aging society very quickly. So in the next 10 years, in China, there will be over 30% Chinese people over 60 years old. And another very challenging fact is birth rate is dropping very quickly in China recently. So Dr. Molita, I know you are very experienced in this area. I want to invite you to share a little bit about your experiences about aging dermatology. So what challenges have you ever seen in Japan, and how can China borrow these experiences from Japan and when we are facing more and more aging patients?
That's quite important. And of course, I'm now the vice president of my university hospital.
You are the best.
Yeah, the vice president of my university hospital. That we always think about who come to the university hospitals. And of course, I'm a dermatologist. We have to think about dermatology. Dermatology is quite fine. We have many patients, many refractory patients. So no problem at all for for dermatology. But however, the other problem, like surgeon, internal medicine doctors. So we now think about the number of patients, especially for inpatient.
Yes.
It's very hard to get inpatient.
Yes.
It's very unnecessary. That is, we have to always think about how we can provide healthcare and for aging people. So we have to take care of it. And even in 80 years old, 85 years old, we're still doing surgery. So it's very safe, very good anesthesia. So now think about aging people. They can do very nicely. We can say it's their happiness, well-being. So that is we are targeted and a term well-being.
Yeah. So when you talk about the well-being, so I believe you are also talking about the quality of their life.
Yeah, and then speaking of quality of life, I agree with Professor Morita has said. I want to say also what we're seeing globally is the role of women changing and evolving globally. So we're having in different countries more and more women coming into professional roles. and there's can be potentially a conflict between the professional responsibilities versus child rearing responsibilities. I know this is a dermatology podcast, but if I may, so I think about the society's responsibility or opportunity that one can provide to women in terms of supporting the child care at home, so that having children is not viewed as something that can be taken away from someone's professional achievements, but it's something that not only women but also men together can do as a family, sharing of that responsibility. So I think there's a lot of modernization that's going on globally, and it's a conversation I think people have in their private spaces, but I think really think strategically about having supportive systems for everyone, so that there can be this system where our children can grow well, successfully, and being well educated, yet also people can flourish professionally as well.
Yeah, I quite agree with you that the patient, including their family members, caregivers, they're all very supportive in this ecosystem. And we are also collaborating together to provide them very supportive environment, especially to some very specific group of the patients, like female or aging populations. So, Dr. Molita, that we understand that the disease management is very important to the patient. So, and in China, we say patient is the owner of their own health. So they are the first people to take the responsibility to take care of themselves. And you just mentioned the doctors and the environment are very supportive to the patient care. But can you share with us a little bit about, in Japan, how a patient can be their owner of their own healthcare? How can they control or manage their own healthcare in terms of the psoriasis management?
Oh, that's a really good point. So former time means in our healthcare covered by health insurance, we have only one health insurance system, only one pension system since 1960.
Okay.
So that is we cover everything by the health insurance system, but the amount and expenses are increasing rapidly. So hard, so much money need to treat everybody. Nowadays we have to think about how to prevention, how to think about our health, because very hard to get an equal and healthcare and everywhere in Japan. Okay, in center it's fine. It's like Tokyo, Osaka, whatever, my city, Nagoya. It's center is fine, but rural area, it's less service, less healthcare providers. So that is a big problem and whatever. Then they,
Same thing in China.
already?
The same as China,
Really?
yes.
Then they need to, it's a long time to drive to get a very nice hospital, to clinic. Also, they search by themselves, by the internet, by the SNS. That is happening, things happen everywhere in Japan. Now it's so easy to connect to the internet, so they find it's very good, appropriate place to be visited.
So that is digital health.
Digital health. Then also, now we think about the world is like D2P with nurse. D, doctor, to patient, with nurse.
With nurse,
So first then I go to nurse in their home, then I connect to the internet to the doctors.
Yes.
So, okay, internal medicine doctor, dermatologist, whatever, connect to the first then nurse visit to their home. It's a cover in this way. Doctor D2P with nurse.
D2P with nurse, yeah.
It's an idea and a coverage in the rural area. So especially for dermatologists, it's very hard to
make appointment, right?
Get in a good dermatology service in the rural area. It's in the center is fine, but the rest of the area we have to think about. D2P with nurse covered by the good dermatology.
Okay. So the patient actually they can take picture of their disease and send it back to the doctor.
Not really common, but we want to start it. How about you in the United States?
Yes, yeah. So we have a pretty robust telehealth system, and I actually directed the telehealth program, Telederm program, back when I was on faculty at UC Davis. So we could connect with patients two ways. One is with a live interactive telemedicine, and now at UCLA we do telehealth, so the patients can connect with us via video. We do take a lot of time trying to see what's going on, you know, because people with different skills. So I learned to read a lot of ceiling fans in the process. But patients actually really appreciate that because that way they don't have to drive hours to come see us. So, and then another model that I find is helpful is perhaps for that initial visit, it's helpful to have a face-to-face so that the patient can really establish the trust, and also you get to see their skin lesions in person, which is still very different from seeing it over the video, because maybe their internet speed is not very good. But at least you have a bit of a confidence in terms of when you're doing maintenance of care, you can use telehealth to supplement.
Well, China has released a policy back to 2017 to encourage the telehealth from the public hospitals and also the private sector. So Dr. Shi, here is a question to you. Can you share a little bit about experiences in terms of the digital health or telehealth? Are you using digital tools to engage with your patient or provide some online consultation to these patients in the remote area?
Yes, I think in China, make a very high progress in digital health because China has a very big population. Yeah, as you mentioned, China the same as problem as in the main city is no problem. A big hospital. All the big hospitals located in big city, but in the rural area, it's very difficult to make an appointment, and they need to take transportation flight to the the cities. So the government encouraged the hospitals, especially public hospital, to set up the online hospital. So it's very convenient for patients, especially for the follow up. Just Professor Ibrahim Zhang mentioned. The first visit is very important, in the face-to-face, and the patient can trust us. Then, some patients from northeast, west-east, from Chongqing, so some patients just take flight to Shanghai to see us. So it's, cost is very expensive. So after, the first visit, we just encourage and introduce our online hospital. So they can just very, very convenient. Just online to see us. And we just from the first visit history, then they give us some, the follow-up, some information. We just prescribed the, drug online. And, our hospital have a very good system, just ship the drug to Chongqing, to Harbin, to everywhere, and very quick. So the patient is very convenient. In my hospital, because I'm from Shanghai Skin Disease Hospital, Chongqing University School of Medicine. So our hospital, every year, the online patients increase a lot. I think maybe this year about 10, the 100,000 patients online. It's not so many. So we just want to do more because it's very convenient to patients. Also, in my hospital, almost this year, almost 1.7 million outpatient. So we just encourage patients just to go online to see doctors. We don't have so many physicians, so many rooms to see patients. So I think it's a very good solution. Yeah, I think so.
A couple of things that IPC has worked on in this area. Fairly after COVID, we wanted to make sure that psoriasis patients weren't sort of getting pushed aside and treated properly because all of this movement in telehealth. So we put out some statements around when we thought it was appropriate to be in person versus be online. And now we have a digital health working group that's looking at, everything's moving so fast. And we thought, well, what could we do that's of value? And what we've done is we have collected information from our experts on how are they using digital health in their community, whether it's telehealth or artificial intelligence. And we want to sort of highlight these examples of success that can be used in other parts of the world. So. And just as a note, all of our programs, our papers, our statements are represented from the doctors from all parts of the world. So we always have representation from Asia, North America, Europe. So we try to give it a global perspective. Yes, there is. Yes. But we hope by sharing some of these successful examples, it can help other.
Actually, my last question is to you. It's more like closing remarks. I want to invite you to share some ideas from your side after you're hearing these ideas that we are having digital health, that we are encouraging the patient management, and we are also collecting the wisdom together, generating international and also domestic songbook. Yeah. So
I think the strength of IPC, we are small, but I think we're mighty and we're global, and our value is to help facilitate knowledge exchange. Everyone, no matter where they are, this group of experts have something to bring to the table and exchange that information. I think, China is, in all areas, is very strong in digital work and technology, and I think there's a lot that the rest of the community can learn from that. I think that bringing these different expertises together and try to facilitate it is really what our mission is about. So
there is a Chinese saying that if you want to go fast, go alone. If you want to go far, go together.
I like that.
It's an American saying.
It's global. Well, thank you very much for your time. Thank you.